Good morning, good afternoon, good evening to all of you, depending on where you're joining us from. We thank you for allocating your time to joining us for this webinar. Can we have the slides, please?
Explain the interpretation, but
yeah. So before we start with the presentation, just to a couple of housekeeping pieces of information. On the bottom right side of your screen, there are two buttons, Q&A, where we are kindly asking you to post your questions. The team here will be providing answers throughout the session, and then next to it there is a button on interpretation. So if you click on that button, you can choose between English or French translation. So without further ado, let's now start the session, and let me just introduce the team here. My name is Babis Ismanidis. I'm with the Global Program on Tuberculosis and Lung Health. Can you move to the next slide? I'm the team lead for the Strengthening Surveillance, Epidemiological Studies and Data Use for Action team. To my left, I have Gita Parwati.
yeah, good morning, good afternoon, colleagues. My name is Gita Parwati. I'm working with Babis in his team.
To my right, I have Marek.
Good morning and good afternoon, everybody. My name is Marek. I am that camera. Also part of Babis's team here at the Global TB program, focusing on strengthening surveillance systems for TB.
And our dear colleague Namdi.
I don't know what to look at now. Okay. Good morning, everyone. Namdi Waneri. I work with the Global Fund. I am the TB, M&E, and surveillance focal point.
And we should have with us online our colleague from the Gates Foundation, Guy Stallworthy. I'm not sure if a guy has joined yet. It's very early where he is at the moment. Guy, are you online? Okay, so
I'm online.
Please go ahead.
Babis just joined.
Wonderful. Thank you, Guy. All right, so this is the team that you will be interacting with. Let's move on to the next slide, please. So what are we going to be talking about today? I have to say this is it's quite a special day for us, because the TB digital platform is a labor of love, and it's one that has had a long gestation period. We've been working on this for close to 4 years now. And we are finally ready to launch this. We're very excited for that, to be sharing this new product with you. So the TB Digital Platform, which is hosted within WHO's World Health Data Hub. And what we will be covering specifically today is how to use the TB Digital Platform to support strategic planning and prioritization at the country level. So the webinar has 4 parts. I will be delivering the first part, a bit of an introduction on the principles, challenges, and a suggested solution for strategic planning and prioritization. Part 2, Gita will be taking over to provide you with an overview of the TB Digital Platform, as well as a live demonstration of the dashboards that are already published. We are then moving to our questions and answers section. We will have 2 short commentaries, one from Guy from the Gates Foundation and one from Namdi from the Global Fund. And then we will open the floor for questions. And we will finally close the webinar with a summary and a description of the next steps. All right, so let's talk about strategic planning and prioritization. Next slide, please. So these are some of the key principles that we should have in mind when we are considering, when we are actually going through these exercises of programmatic planning and prioritization of activities. These should be data-driven, they should be inclusive, and they should be aligned with the broader health system goals. There is a need for a structured approach for integrating epidemiological, health system, and behavioral data, disease burden estimates, cost and effectiveness data, and all, of course, have equity considerations. The process should focus on high-impact interventions, ensuring sustainability and alignment with the universal health coverage principles. All this is quite nicely described in the document we're providing you the reference with. So in summary, one suggested approach to planning and prioritization is the 3D approach. So to start with identifying the data that are required, using the data to guide dialogue among stakeholders, and then make informed evidence-based decisions. Next slide, please. However, the process is not an easy one, and there are key challenges. And what we have experienced in the past is that often there is a lack of clear goals, objectives, and targets that can hinder the process, or there are important data gaps and limited data use, so data could be incomplete or outdated, the interpretation of the data might not be correct, and then, of course, all that compromises the quality of the strategic planning and prioritization process. And then finally, another extremely important challenge is the inadequate engagement with and collaboration among all the stakeholders. The NTP, the National TB Program, or an equivalent entity within a country, of course, sits in the middle of all this, but there needs to be dialogue and engagement with all the stakeholders in the country. And we will provide some more details on that later on. And then what was very evident, what was evident also a few years back was that while there was really a plethora of data generation tools and studies and surveys that became available to national TB programs and their partners, it was also quite evident that, in fact, the resulting priority interventions and the decisions that were taken to identify these interventions were not often informed by all the available information. Next slide, please. So the suggested solution, and this is described very nicely in the WHO publication on the guidance for national strategic planning for TB that we're providing you the reference with a QR code with. The suggested solution is a country-led strategic planning process. We broadly envisaged 6 phases, so starting from the planning and preparation, moving to the situation analysis, and then to formulating goals, objectives, interventions, and activities. Then moving on to developing the metrics and activities for monitoring, evaluation, and review, carrying out the costing analysis, and then finally ensuring that there is a consensus and endorsement of the plan, along with the dissemination and resource mobilization for the plan. Next slide, please. To support this process, we have the people-centered framework for TB program planning and prioritization, and this supports primarily phases 2, 3, 4, and 6 of the planning process. It essentially supports countries to effectively use all available data and evidence to inform policies, priorities, planning of activities, and funding allocation. And it also helps countries to systematically consolidate data and evidence along the care continuum, facilitating a people-centered analysis and allowing for a discussion on prioritized actions. So in a bit more detail, I will be describing the people-centered framework. We say that there are 3 elements. One, the care continuum, The second element is that on the types of evidence that are being used. And then the third element are the various planning steps that people go through as they implement the people-centered framework to come up with the prioritized activities. Next slide, please. So the care continuum, we have framed it in three major steps. As you see the columns on the figure that we're presenting here. So the first step refers to people who are not accessing the health system. And then we've broken down into three different populations. One, people with TB infection who have a high risk for disease. Another one, people with asymptomatic disease but not seeking care. And then the third group, people with symptomatic disease who do not seek care. Then moving to the second large step in the care continuum are people who seek care, but they are either not diagnosed or not notified. So that includes people who present to health facilities but are not diagnosed, or people who are diagnosed by the non-NTP sector, let's say the private sector or part of the public sector that is not part of the typical network of the national TB programs. And then finally, the third group is people who are diagnosed by the NTP but are not notified for whatever reason. And then the third large step that we are proposing for the care continuum involves people who are notified as a TB case but are not successfully treated. And among those, there are three major groups of people: those who are diagnosed but have not started treatment, those who are notified but have not been successfully treated, and those who are successfully treated. So this is the care continuum that we are proposing for use in the people-centered framework. And then along that care continuum, we are placing the available data and evidence. And we use these steps, these 9 essentially steps, well, 3 steps with 3 populations in each of them, to place the different data and evidence that we have available for the prioritization and planning process. Next slide, please. So the second important element of the people-centered framework is the type of evidence. So we are we've summarized the evidence into epidemiology, the epidemiological aspect. So to answer the question of knowing your epidemic. Second is the people aspect, and then the third, the health system aspect. We're providing here some examples. So for the epidemiological aspect, we are looking at things like burden of TB disease, including its distribution and trends for both drug susceptible and drug resistant TB. And we're also providing some examples of sources that countries can use for bringing together this information, this data. On the people aspect, this includes things like the risk profiles. So, for example, the age and sex breakdown, the socioeconomic status, HIV status of people with TB disease, as well as knowledge and behavior of people with TB and those at risk of developing TB. Equally, we are providing a list of suggested data sources for this type of evidence. And then finally, the system aspect that includes data that describe the capacity, the performance and distribution of health and social services for TB specific and health in general. So we are really looking, as part of the people-centered framework, to promote this holistic analysis of the whole environment and to ensure that all relevant data and evidence are used for the process. So it's not just about TB epidemiology, it is about the health system, it is about the overall public health architecture, it's about people's behavior. So we're promoting this holistic analysis and really nurturing this whole of system thinking and promoting this people-centered approach and solutions. Next slide, please. So once we have done that, once we have identified the different types of data and evidence, we then propose 3 planning steps on how to use the consolidated data and evidence to inform the discussions along these different steps. So the first step is the problem prioritization. So this is where we're trying to assess the magnitude of the problems by systematically reviewing the data across the care continuum and identifying priority focused areas. The second step is the root cause analysis. So for each priority area from the first step, we identify the root causes that are creating the problems. And then finally, the third step is the intervention optimization. So for each of the root causes, we identify areas of action and associated strategic interventions to optimize impact. And Geeta will be providing a very nice example of this later on. Next slide, please. So we thought it would be a good idea to also provide you with a good example of the implementation of the people-centered framework for the development of the National Strategic Plan. So we're providing you with the example from Indonesia. This is the exercise that was done in 2019. So the main objectives of the workshop, the PCF workshop, were to engage with all relevant stakeholders, to conduct a TB situation analysis based on available data, to reach a national consensus on priority issues, and finally to agree on a joint action plan. I'm not going to read through the rest of the slide, but I do think it's impressive, and I wanted to make sure that we share that example with you, the amount of stakeholders that were engaged for the development of that NSP and for the implementation of the people-centered framework. So it was a very wide range of stakeholders from the health sector, and you see here many different programs, disease programs, health facility services, drugs management, research, etc. There were also a lot of stakeholders from the non-health sector, and on my next slide, I will explain why that is important. But the non-health sector is extremely important in TB as well to engage with, particularly when developing a national strategic plan. And then finally, Indonesia is a very large country. There are 34 provinces involved, but of course, so there were representatives from each of the 34 provinces. In fact, it doesn't matter how large or small the country is. This is very good practice to always include subnational level colleagues during these exercises. Next slide, please. So this is just an example of some of the priority activities that were agreed during that workshop. So really the main theme that came through from that workshop was that there were opportunities and potential collaborations across different ministries and sectors. So I'm going to give you some examples of these potential collaborations. So the National TB Program collaborating with the Ministry of Religion. So the activity was regular TB screening for students who attend boarding religious education institutions. And you see that was a huge number of more than 5 million students reached that way. The collaboration with the Ministry of Social Affairs was about providing patient support for shelter, food, and patient transportation costs. A collaboration with professional organizations was about overseeing the implementation and management of TB according to the standards that were laid out by the members of the organization. The collaboration with the local district governments that have their own budgets allocated to them was to ensure that people with TB were included into the list of individuals who were covered by national health insurance, which is paid by the local governments. And then finally, there were multiple collaborations across departments within the Ministry of Health, so with maternal and child health, with non-communicable diseases, with HIV, and that was about strengthening the coordination in implementation of TB screening among high-risk populations. Of course, all this is the result. There was a huge amount of work that went into it, particularly with the data consolidation process. Collecting all the evidence took 3 to 4 months. Positioning the evidence in a way that can facilitate the discussion all along the pathway of prevention and care was also required a specific skill set. So as we were implementing the people-centered framework early on, we realized that there was more that we could do to support and facilitate this process, support countries and facilitate this process. So hence, next slide, please. We set out to develop the TB digital platform. So this was developed with the goal highlighted in red to ensure the safeguarding and to significantly facilitate the consolidation, analysis, and visualization of the required data for strategic planning and prioritization. So I'm going to pass the floor now to Geeta to move on with part 2 of this webinar.
Yeah. Thank you, Babis. So now I'm going to give the overview of the TB digital platform for strategic planning and prioritization. And as Babis already mentioned, basically the development of this platform really minimizes the time that are required by the TB program to basically bring in all relevant data that are appropriate for the development of national strategic planning in a very short period of time. And then there's also the view of sustainability of this data, where things will be then further updated and then readily made available for country to be provided with whoever is supporting countries in various activities, including development of strategic planning and prioritization. So this is the concept of the TB digital platform data repository analysis and visualization. There are 3 levels, and as you can see here. Level 1 is related to data sources. Level 2 is related to a single data repository. And level 3 related to an output or visualization of the data. On data sources, we would like to bring in various data sources that already Babis mentioned that are relevant for TB program planning and decision making, including development of strategic plan. So here, we categorize the sources into those that are associated with primary data generation, such as the routine surveillance, periodic priority TB studies, those that are associated with secondary data analysis, such as the standard and benchmark assessment that normally we do during the epidemiological review, diagnostic network optimization, and patient pathway analysis. And the third category is the existing repository or platform. For example, Global TB Database, the World Bank Database, Global Health Observatory, and others. While some of these data sources have already had standardized indicators, particularly those that are coming from the existing repository or platforms, there are some where we need to identify standardized indicators that can be used to inform program planning. So for example, the prevalence survey, it may provide not only TB burden estimate, but also information on health-seeking behavior of people with TB or TB symptoms. The same with the inventory studies. It may provide not only level of underreporting, but also evidence related to the adherence of the non-NTP sector on diagnostic and treatment guidelines. We call this process standardization of indicators. So you see the data source that are colored in green are those that we already brought to the already published dashboard, while those in yellow are the one that we would like to include in the next phase of this work. Now, these data sources are sitting in different places, and therefore we would like to pull this data set and store them in a centralized data repository, in this case, in what we call World Health Data Hub Data Lake, we will explain later, and the XMART. This is in the second level, as you can see. To a certain extent, some of these data are already available with the Global TB program, and we have uploaded those data to the WHDH data lake. The other functionality that we would like to have is also the upload of relevant data from existing repositories. So from the Global TB Database, World Bank, Global Health Observatory, as you see that, we bring them also into this central data repository. Another function that we would like to have is a user database where people who access the platform are also able to basically take or download the data for any other secondary analysis. What is also important to mention here is that there are two access to the database, which is public and restricted. Public means anyone could access the data, as we will show you in the demo. While restricted means it's only a restricted number of people, which will be granted by the national TB programs, that will be able to see this, what we call a locked-in environment. What will be included in the locked-in environment is, for example, the data that the country wants to keep it within a restricted view, for example, subnational level surveillance data, or other data that country wants to restrict the access. Then the final function of the platform is related to the output or visualization. So we are creating a standardized analytical dashboard that helps visualize relevant indicators to inform program planning. So in the same way as the access for the user database, access to the visualization will also be divided into public and restricted. So here are the data that we are included into this platform. As you can see, there is those that are primary data generation, secondary data analysis, and repository. Those that are in green color are the one that we already included, and the one that is in black color is the one that we are going to include in the next phase. So the routine surveillance, WHO TB burden estimates, TB surveys, the non-NTB surveys, standard and benchmark assessment, and also the various repositories you see on the right side, those are already included. We are now in the process of including the subnational level that will be available in the locked-in environment, and also in the process of developing a public-private mixed dashboard. So this is the public-private mixed dashboard currently under clearance process. So we are very close to publishing this. We will be able to show you the dashboard that will be made available soon. And also we are working on the other secondary data analysis dashboard, as you can see there in the black color. So in terms of the type of dashboard, we are developing 3 types of dashboard. So the first one, we call it country profile. So this includes a selection of priority indicators from multiple data sources. So for example, the TB epidemiological profile, and we also include and map the selected indicators throughout the continuum of care. You will see that in the dashboard. So in the country profile, those are selected priority indicators. But then we also have what we call data source or topic dashboard. So this includes a more detailed list of indicators or information on a single data source. So we have data source a dashboard for TB prevalence survey, for drug resistance survey, household cost survey, inventory study, you will see that later, and also the topic dashboard, such as the public-private mixed dashboard. And then we will have what we call the indicator page. So this is basically for we will have a dashboard for a single indicator that will allow cross-country comparisons, and this dashboard will be accompanied by a comprehensive metadata. So we would like to show you how those different data sources are actually included in the country profile particularly. So you will see later on the TB epi profile, this will include data mostly from the global TB database and the population data from the World Population Prospect. Those in the care continuum step 1, we will have data from really various data sources, as you can see here, global TB database, global health observatory, national TB prevalence survey, and the various existing database. Those in the second continuum of care, we include data from the global TB database and national TB inventory study. And those in the care continuum of step 3 include global TB database and data from the national survey of costs faced by households affected by TB. And then these are the other data source specific dashboard that are also already available. So those associated with the routine TB surveillance indicator, TB financing, TB prevalence survey, household cost survey, inventory study, and drug resistance survey. So within each of the dashboard, there will be some subsections. So as you can see here, the TBAP profile, there is subsections on the population incidence, mortality, screening and prevention, detection, HIV testing and antiretroviral therapy, drug resistance TB. And then also the other C here, I will not mention one by one, but there is a navigation pane that will help you go through each dashboard and find the indicators according to these different headings. And this is for those data source specific dashboard. As you can see here, from dashboard 5 to 10. And just also for your information, we already populated the dashboard 7 to 10, which are the dashboard associated with TB periodic studies. And we included the data where the data are made available to us or available to the countries that have implemented the survey or the study. So dashboard 7 to 10 for those who have implemented the study, but for dashboard 5 and 6, for example, it includes data for all countries that are submitting the data to WHO as part of the global annual data reporting. So many of you are already familiar with this key step Babis also mentioning earlier, the steps that are involved in developing national strategic plan for TB. The TB digital platform is particularly useful in supporting phase 2 to 4, where data analysis, strategic prioritization, and operational planning take place. As a central repository, the TB digital platform consolidates relevant data from various sources, thereby substantially reducing the effort required to compile and organize information. It presents the data in a standardized and accessible format. And we are also in developing a guidance document to basically support countries in interpreting the data visualization, thus enhancing the platform's utility during the situation analysis, helping further the stakeholders involved in NSP development when conducting the situational analysis. The platform also transformed diverse data inputs into actionable insights. So by integrating surveillance data, national surveys findings, and key indicators from various repositories, it enables countries to identify epidemiological trends, detect programmatic gaps, and understand disparities across population. And this evidence base informs the formulation of goals and objectives that are grounded in reality with clear baselines and measurable targets. While the current version focuses on national level data, as I mentioned, the upcoming features will include subnational level data and surveillance data by type of healthcare providers, public-private mix. So this will further enhance the platform capacity to support strategic decision-making and will help countries identify both geographic and sector-specific gaps, enabling more targeted interventions and greater alignment with equity and access. The platform also supports the design of operational activities by highlighting programmatic bottlenecks, such as limited diagnostic coverage, underreporting, or low treatment success rate that can be addressed through focused efforts. A regular update of the platforms will allow regular monitoring and also midterm review of the NSP implementation, and thus offering countries the flexibility to adapt strategies as new data become available. The TB digital platform is currently hosted on the WHO World Health Data Hub. This is a state-of-the-art system that supports data management across the organization. It offers an end-to-end solution for managing data in a consistent, secure, and efficient way, ensuring that data remains accurate, timely, and usable. This infrastructure is built around the 5 core products that work together to support the WHO growing data needs. So the first one is the data storage, data lake. is a centralized repository that provides secure storage for large volumes of raw data. And then the data science lab, this enables advanced analytics, modeling, and visualizations. The country portal, this is the space through which member states can access, exchange, and validate their data. So we are using also this country portal basically to obtain the subnational level data from the country. And then XSmart, this is the tool used for harmonizing data across different sources and format. And finally, for the dissemination, we are using the data.who.int. This is the public dissemination portal, which makes curated data sets and dashboards available for wider use. So the WHDH is a modern, agile, and scalable solution addressing today's need and paving the way for tomorrow's. The TB Digital Platform benefits from this robust infrastructure, making it a powerful tool for country-level analysis, strategic planning, and global monitoring. For more information about the World Health Data Hub, you can see this data.who.int. So now I'm going to show you or to demo basically the platform, as you can see here. So these are already made available publicly. So and we have already populated, as I mentioned, for most of the data source for all available data for all countries and territories. As you can see here, there is a drop-down menu for that you can choose which country you would like basically to view the data. What we are choosing here is from Nigeria as an example. And here you can see there is a language. At the moment, we are only available in English, but we hope to be able to make it available for other language as well in the future. As you can see here on the left side, these are the navigation pane where you can see the different dashboard that are available. So dashboard 1 to dashboard 4, these are the country profile, where data from various sources are mapped accordingly. And dashboards 5 to 10 are dashboards that are specific to data source, or later on, we will also show you the PPM one. And then as you go along, you will see there is also navigation pane that will help you immediately go through the relevant sections that you want to see within the dashboard. I will go through relatively slow. I will not go through everything, but just going to show a couple of dashboard with you. So what is in the TB epidemiological profile, it will give you a high-level overview of the epidemiology of TB in the country. So we can see here the population of the country throughout the year, and also disaggregated by age and sex for the latest available year. We can see the estimates of the TB burden. In this case, what you see here is the estimate of the incident, the number, the absolute number, and also the rates per 100,000, both for overall TB burden and also HIV positive TB incidence. We can see the TB burden disaggregated by age and sex. The left side is absolute number and the right side is rate per 100,000. We can also see the percentage change of TB incidence rate between 2015 and 2023, the number of people with attributable TB attributable to 5 risk factors. So in this case, for Nigeria, we can see that undernutrition is the risk factors that are contributing more to the TB in the country. And then also there is the burden of rifampicin-resistant TB, both for absolute and rate per 100,000. And we can also see the percentage of rifampicin resistance among new or retreated patients. And then in terms of mortality, we have the estimated number of TB deaths, absolute number, and also rate per 100,000 for all TB mortality, those excluding HIV/AIDS, and those specifically for people living with HIV, so TB/HIV. And then the estimated number of TB deaths by age and sex, absolute number, and rate per 100,000. And then the percentage change in number of TB deaths between 2015 and 2023. And then in terms of TB screening and prevention, we have the percentage of household contact evaluated for TB, and also the number of those started on shorter TB preventive treatment regimens containing rifampicin and rifampicin, the number of household contacts started on TPT for children below 5 and above 5, and also the percentage. So on the left side is the absolute number, on the right side you can see the percentage. These are for children below 5, and under is for children above, for all close contact above 5, and also percentage of household contact who completed TPT. And then the next you can see the number of people living with HIV started on TPT, and then those who are on ART, the percentage who are started on TPT as well, and then the completion rate if the data are available in the country. It's not the case for Nigeria. And then for detection, we give a high overview on the number of people diagnosed with a new episode of TB, absolute number, and rate per 100,000. And we can see here in Nigeria, there is a dramatic increase of notifications from 2020 to 2023. And we can see in the next, then the disaggregation by age and sex, absolute and also rate. And then we can see the notification disaggregated by pathological confirmation and site of disease. And we can see that the substantial increase of new episode of TB in Nigeria is also very much driven by the diagnosis of pathologically confirmed pulmonary TB. And then we can see also the overall TB treatment coverage throughout the year. Then there is also on the HIV testing on antiretroviral and therapy services. So the cascade of care. So first is the number of notified and how many are those are HIV tested, how many are those are HIV positive and HIV and put on ART. And then you can see, so the two chart above, you can see over the year, but then we can also see the cascade of care for the latest available year here for TB HIV. And then the same also for the drug resistance TB. So you can see how many are pulmonary bacteria confirmed TB diagnosed, and then how many are of those tested for rifampicin resistance TB, and then how many are then diagnosed with rifampicin resistant and then enrolled into the treatment. So you can see here there is a gap in testing for rifampicin resistant, and there are also a gap in putting people into rifampicin resistant or a DRTB treatment. And then there is also a cascade of care available for the latest available year. As the global TB report will be for 2025 will be published later on, we will also update this data with the data for 2024 when it will be available. So this, and then there's also the glossary and metadata that you can briefly see here. I'm not going to go through into that, but this will be helpful also to understand what are the charts or what is it about. And then now I'm going to go through just one example of the continuum of care, so also the country profile. So let's go with the first continuum of care. This is for people not accessing the health system. So many information associated with the risk of getting TB. So there is an HIV prevalence. Maybe we can have a look at Indonesia, for example. Yeah, so you can see here there is an HIV prevalence, alcohol use disorder. These are from Global Health Observatory, diabetes prevalence, estimated of tobacco smoking, BCG immunization, probability dying by age of 5, showing the strength of the health system as well. We also have indicators related to the prevalence of undernutrition, both for children under 5, adolescents, and also adults here. So these are all from Global Health Observatory. We also have data associated with screening. So this already also showed in the TB epidemiology profile. So I'm not going to go through into the detail, but the data related to the screening are also there. And also we have data associated with the social protection. These are from the ILO database. population covered by at least one social protection, and public social protection expenditure for the percentage of GDP. We also have data associated with the proportion of household spending for health greater than 10% or 25%. This is from the Global Health Observatory. And also prevalence of moderate or severe food insecurity in the population. Then we have data also from socioeconomy. This is from the World Bank related to the GDP, both in constant or constant local currency or the current local currency unit, and also the constant international dollar. Also the health expenditure per capita, and poverty headcount ratio, both at the national standard or international standard. Also, we have data associated with the SDG indicator related to the access to clean fuels, and also the Gini index showing the inequity in the country. We have also data associated with the percentage of urban population living in slum. And also we have data associated with the detection. So this is from the both global TB database and also from the TB prevalence survey. This is basically indicating or giving an insight on where is the underdiagnosed and underreporting are happening more. Just pay attention that some of the data of the prevalence survey are already old. So each time you see a cross-sectional data, always pay attention to the year of that data that are available. And also we have results from the prevalence survey in terms of screening of the chest X-ray and also symptoms as well. Here, also the health seeking behavior that are useful to inform, to understand where the patients are seeking care. These are also from the National Prevalence Survey. So these are from the continuum of care. I'm not going to go through the dashboard, the second step and the third step, but I want to show you one of the dashboard that are associated with a specific data source. So in this case, for example, the National TB Prevalence Survey. So more informations are there. Here, for example, you can see the prevalence estimates of biologically confirmed, also by smear there, and also the rate ratio that you have already seen. There's also the survey flow here. There is also the result of the screening and diagnosis throughout the studies, and also the healthcare seeking behavior. Another one that we can see quickly is the household cost survey, here where you can see more detailed information on the percentage of catastrophic costs by type of TB, but also by income quintiles, the costs that are associated with TB treatment, also the distribution of this total cost by cost category. More information on individual household income and poverty rate before and during TB. So you can see also the impoverishment during the TB treatment. And also data associated with the coping mechanism and social consequences here. And also data on the risk factors of facing costs or catastrophic costs. And the last dashboard that I want to show you, and this is now we are undergoing clearance, is actually the data associated with the public-private mix. So these are surveillance data that we further disaggregate into the sector of the healthcare and the level of healthcare. So you can see here basically the contribution of the TB diagnosis by public sector or private sector, private for profit sector, private not profit sector. You can also see here the contribution of public-private mix to the notification throughout the year. You can see the access to rapid testing, both at the public and private sector. The bacteriological confirmation, both at the public and private sector. So it's really giving you the overview of how actually the TB service are both in public and private sector. I'm not going to go through, but this will be made available very soon. So basically now you can see that there are a huge amount of information available in the digital platform. And I will just show you very quickly how actually we are using this available indicator in the dashboard throughout the planning process in this context is in the context of developing a national strategic plan. So you see already this continuum of care, and now we are just going to zoom in into one of the continuum of care, which is the middle, which is people with TB seeking care, but either not diagnosed or not notified. So now we are going to basically identify problem within this continuum of care. And you can see it might take time for you to get familiarized with all of the indicators that are there. But I'm going to just show you here just to make it more easily to see how basically we bring in this data from this different data source, from this different dashboard to basically identify the problem in the country. So now in the second dashboard, people with TB seeking care, but either not diagnosed or not notified, here you can see there is three charts outlining the incidence of the TB cases in the country, the number of people diagnosed, and the TB treatment coverage. So we can see here that there is a 23% treatment coverage gap in 2023. And then we can also see there is also a chart on the percentage of people diagnosed with the new episode of TB who were initially tested with the WHO recommended diagnostic tools. And we can see here that not everyone is tested initially with WRT. And we can also see even a decline proportion from 2020 to 2021. So this is another problem that we identified. And then another problem that we also can identify from the dashboard is associated with the bacteriological confirmation. So as we can see here, only 57% of bacteriological confirmations are among people with new episodes of pulmonary TB. And we can see here there is also a declining trends. And if we can see the chart of the DST testing among new and retreated, we can also see that not all people diagnosed with bacteriologically confirmed pulmonary TB are tested for rifampicin resistance. So this prevents the timely diagnosis of rifampicin resistant TB. So this is just a simple example. I'm not going to go through everything, but just from this simple example, you can see that there are already three problems that we identify. Those associated with the coverage gap, the treatment coverage gap, those associated with WRD testing, and those associated with the bacteriological confirmations that preventing us from diagnosing drug resistance TB. And then once the problem is already identified, now the country may want to basically do a root cause analysis, also what Babis already mentioned previously. And we can see, now let's focus on the gap in terms of case detection. So when we are conducting the root cause analysis, we want to try to understand why people with TB, in this case not seeking care, why people with TB that already seeking care are not being diagnosed. And we want to find the root cause of these problems from these 6 different aspects. So those associated with people or human factor, those associated with environment or external condition, those associated with equipment, which means tools and technology, what are factors or root cause associated with process, which is system and workflows, data, which is information and reporting, and policies, which is regulations and guidelines. So now we try to see from this aspect, why are people with TB seeking care are not being diagnosed? I will just give you an example of few of them. So in terms of the people aspect, we have information from the household cost survey that a substantial amount of people are experiencing catastrophic costs due to TB. And here you can see that even more substantial amount of proportion among people with drug-resistant TB. And also people with the lowest income quintiles are experiencing more catastrophic costs compared to those in the higher quintile. And we have also informations on which cost category are actually people spending costs for getting TB diagnosis as well as getting TB treatment. And so these are leading to a questions, basically whether the TB screening and diagnosis service are provided free of charge in the country. So country may want to try to see whether these are actually the problems why people are not being diagnosed. And then another information, this is coming from the prevalence survey, for example. We know from the prevalence survey in this country that there are only 50% of those bacteriologically confirmed during the survey are actually, there are 50% of those diagnosed as pathologically confirmed did not report symptoms. And so the country may want to reflect on the screening algorithm for TB. Have the country used the more sensitive TB screening tools such as chest X-ray, or the country relies on more classical symptoms of TB, which is cough or fever or hemoptysis, which is actually it has some more much less sensitivity in terms of screening TB. And then also for the prevalence survey, we can also see that people are actually seeking care not only to the public, but also the private sector. So then the question is, do the private sectors have access to WHO recommended rapid diagnostic tools and treatments? So this can also help the country to identify why people are actually already coming to the facilities but are not diagnosed. Then we also have information around the risk factors here in terms of alcohol, diabetes, HIV, smoking, undernutrition from the Global TB Observatory. And many of these patients have been actually regularly coming to the health facilities for control of their disease, or for screening, or for basically care of their condition. And so the question is whether the systematic screening has been implemented for people at risk of TB who have actually accessing the health system for various other purpose other than TB. So this is how the platform then basically can be used for identifying the problem and also helping the country to understand the root cause of this problem. Just also a reminder that when countries are doing the root cause analysis, the TB digital platform are very helpful to support identifying the problem, but also country needs also to bring in other information or other review that the countries are doing in the country. For sure, for example, when countries are doing the epi review and program review, this information should also bring into the table when countries are doing the root cause analysis. This is another example. So for related to the environment or equipment in terms of the aspect for root cause analysis. So you see there is information on the social protection, on the poverty level. So this can raise the questions by the country: is a universal access to healthcare and financial support is available to support country accessing TB services, especially for those living in poverty. And then the other one I already mentioned also earlier about the testing initially tested with the W recommended diagnostic tool. So what are the challenges in ensuring that basically WRD is used as the initial diagnostic tool for TB? So I think I will stop there, Babis, and then we can go for the question and answer.
Okay. Many thanks, Gita, for this wonderful taster of the TB digital platform and how it can be used. Let's move on to the third part of the webinar. The questions and answers. We are going to start from two commentaries from the Gates Foundation first. Guy, the floor is yours.
Thank you, Babis. Not sure my video is not working, or here it is, but I hope you can hear me okay.
We can. Go ahead, Guy.
I'll try to be brief. Firstly, it's been a great privilege for the Gates Foundation to support some of this work over the last 6 years. with not just WHO, but also KNCV, CDC, and many country programs. But I really want to congratulate you and the team for taking it to this stage. It's really very impressive, complex work. And I think we all really appreciated the last part of what you were presented in showing us how to use this data for smarter, more effective program management. Just to step back and reflect on the fact that we're living through an extraordinary transformation, of course, in data during our professional lifetimes. We see this not just in our work in healthcare, but in all aspects of our lives. And it's characterized by the instant access to all kinds of data for everybody in the world at any time. And really, we should perhaps note that this transformation, we're just at the beginning of it. The rate of change in this area is accelerating, if anything. And there's a challenge. We can be overwhelmed by this data, but you really helped us understand how to navigate and make good use of the mountains of data that's available. In this data age, of course, our ability to manipulate data has been matched with a massive escalation in our needs and in our expectations. And if we think about the complexity of TB programs now compared with at the beginning of the DOTS era, when many of our colleagues began working in TB, essentially in the pre-internet age of standardizing recording and reporting tools along the sort of chain of screening and outcome of active TB. And then, of course, we can reflect on how much incredibly more complex our data needs are for program management these days, not just the types of TB and the comorbidities, but all the socioeconomic data, the social support, quality of care, stigma, gender, and then the systems, the PPM that you mentioned, the patient journeys. And increasingly, of course, we're going to have to be better at manipulating financing data. We're going to have new tools to accommodate. And before long, we're going to be needing to really work carefully with data around vaccine and its uptake and impact. I say before long, hopefully before long. In all of this, we have to do this all, and you touched on this, in the context of really greater integration of TB within health services, and which means we may have less control over some of our data than we have had in the past. But also while talking with and working with others in the non-health sectors, which requires us to get much better about using a broader range of data, as we've indicated, socioeconomic and social support and this kind of data. There's a couple of points that, as you know, that I've been quite concerned about as you work through this. One is, it's striking to me how much the TB world still tends to be focused on notification data. You can still go to meetings in which the focus is on how we're doing with notifications, when in fact notifications are really just a proxy, and sometimes a very poor proxy, for the delivery of quality TB services. But we have the ability to be talking about so much more, and we should be doing it routinely. And then another point that, as you know, that's been of concern to me is the fact that we don't tend to disaggregate our data by the level of care to differentiate between TB services delivered at primary care versus in secondary tertiary care, which is so important for an infectious disease, and given what we know about the importance of early care. We're living through, of course, a crisis in financing now. that is leading to massive disruptions of services, that puts such a premium on real-time data. And it's striking that we're still in many of our dashboards looking at 2023 data, and elsewhere on the WHO website, where you're making an effort to help understand the impact of the cuts in funding in countries that used to be USG priority countries for TB. There's still very, very few countries, I was looking at it yesterday, where we have data by month or by quarter this year to look at. So we've clearly got a lot of work to do in getting real-time data. We saw this a few years ago during the COVID crisis, and we're seeing it again now during a financing crisis. But also thinking about the future, in addition to everything else, I would suggest that on the agenda is going to be 2 or 3 things. One is a need to go much further eventually in data transparency. You talked about the distinction between the public data and the restricted data. And I think we all have to recognize that stakeholders and the general public have a legitimate claim on all of this data. We're going to have to get much better at transparency. We're going to have to get better at using the data, as you were indicating. There's such a huge quantity of data, different types of data available, and the challenge is now on us as users to figure out how to navigate it and make best use of what's available. And then finally, we're entering just the beginning of the AI age, which is hopefully going to help us to make good use of that data, but it's going to introduce other challenges. So I'll stop there. It's already been a lot that you've delivered, but I just wanted to give those reflections on what you've presented. And again, to end by congratulating you and all your team for getting it to this point and establishing this platform on which we can all together tackle these challenges in the future. Thank you.
Many thanks, Guy, for these comments. And personally, I'm very open to ongoing discussions about improvement of this work. I see that as a success of the project if people are already thinking about how we can further improve this and make this a tool that more countries can use, and how we can perhaps develop accompanying products such as user guides, etc., to really facilitate this process by as many people as possible. I think we're totally on the same page, and I find that a very positive thing. And your other comments are very well noted, Guy. Many thanks for those. All right, let's move on to the Global Fund and a comment from Namdi. Namdi, the floor is yours.
Thank you. I'm trying to see. I have to turn this way now. Okay. Sorry. Okay. Okay, I think it's fine. So thank you very much. Good day, everyone. Thanks for all who made time to really join this interesting webinar organized by WHO in collaboration with the Gates Foundation and the Global Fund. Babis and Gita have already given an extensive presentation talking on the strategic planning and prioritization continuum, the Indonesia example of the PCF framework using NSP development, and Gita took time to really do this live demonstration of the TB Digital platform, which is, and the subsequent examples of how it could be used were quite insightful. A lot has been said today already by all the previous speakers, so I'll try to limit my comments to the following. It's not news that we are currently facing changes in the financing and funding landscape for global health, but also for TB programming. And what this does is to reinforce the fact that the need for evidence-based strategic planning intervention prioritization and optimization is no longer or should not be viewed as a nice to have option anymore. It is our current reality, and we need to embrace it holistically, especially at the country level. This is whether we're talking about NSP development, strategic planning, whether we're talking about even the development of donor-funded funding requests and proposals, or any future reprioritization efforts that are planned by countries. And as you know, at the Global Fund, this is something that we have been encouraging, and we will continue to encourage, where countries have robust country dialogue to inform the decisions on what interventions should be funded and prioritized. And this should be backed by the latest reliable available data with the country. Now, so it means that we really need to say, when we say data-driven, we should mean data-driven. It's not, sometimes it's a bit theoretical, you use the data and the end, you decide and elevate certain things. But it really needs to be data-driven. The right data has to be brought for analysis, and more importantly, importantly, the right TB stakeholders and actors need to be on the table when decisions are being made on what interventions should be decided and prioritized. And because of all this, the new TB digital platform is definitely a welcome development for national TB program planning. If used properly and sufficiently, it has the potential to significantly decrease the time spent by national TB programs in gathering data for analysis and eventually just using it and ensuring a more efficient data use and less human and financial resources dedicated to this at that level. I kind of look at it, well, the first time I saw it, it looks like, someone wants to have lunch. You want to go to the market first, gather food items, go to the kitchen, cook, and then you're served. But what's kind of happening now is you're sitting on your dining and you are being served the main course, right? Now, that doesn't mean you may not need dessert and other things at the country level that you can add, but a lot of the work has really been taken off the shoulders of national programs and partners and people who support countries in making the strategic decisions. And so I really encourage you to get familiar with the tool, with the dashboards, the platform, and utilize it as much as possible for strategic planning. Now, a lot of the information in there came from the implementation of strategic TB data tools. And many countries have implemented from the plethora, like Bobby described it, right? The plethora of data activities. So this is good. But the one thing we also need to remember is in the future, it's highly unlikely that the level of financing that we had to implement these tools will remain the same. So what this means is national programs, countries, stakeholders need to continually understand their data, the data they have better, and then identify and prioritize what additional supplemental tools in my context can I get to be able to have a good understanding of the epi picture in the country for TB and so on. And so this is something that is very important. And we also hope that the new revised WHO compendium, which is being developed, of course, with WHO's leadership and CDC, Gates, and some of the other partners, can help countries in this kind of decision making at that level. I think lastly, as we go through this process, one thing we should not forget, in the last webinar, I talked a bit more extensively about importance of real-time case-based surveillance, and routine reporting system strengthening. So I'm not going to talk about it, and Guy has also rightly talked about it. But I also want to talk about data quality, because the data is as good as, the data you see on those dashboards are as good as the data that get into them, right? And so we need to not lose focus on the importance of high quality TB data, whether it's behavioral, whether it's epi data, whether it's stigma related and other health system related data for national program planning, because it forms the underlying basis for whatever analysis and decisions that we would eventually take at that level. I also joined Guy in really congratulating the team at WHDH, of course, Gates Foundation and all who have worked in the development of this digital platform. And we hope that it will be a good resource to countries eventually. Thank you.
Great. Many thanks for these comments, Nandi. So I think we have a couple of minutes to perhaps refer to any questions that have come from the floor. So let me first say, because I saw a comment about clearances of sharing this data, just to emphasize once again that these are all publicly available data. So all processes have been completed or clearances have been provided. So we're not showing on the TB Digital platform, the public-facing part of the TB Digital platform, we're not showing anything that has not already been cleared from countries by countries for publication. So as Gita talked about, we are in the process of developing this logged-in environment where countries and national TB programs can safeguard data that they consider more sensitive or that are not ready yet to share. Gita, could I have the last slide on the next steps? I think, because I think a few of the questions we're getting are also related to potential changes or additions and all that. So let me get after the summary. So let's do the final slide. Just give us a minute as we are, okay. The next steps. Okay. So I think a few of the questions and comments that have been posed on the Q&A, I think will be answered from the content on this slide. Just to say that we have already been working quite closely for the development of this platform and for the implementation of this platform as part of strategic planning and prioritization. We have been working quite closely with 11 countries that are part of what we call the Prime TB project. We're not seeing it. So there's already been quite a bit of work on that. No, previous. Okay, right. So just to, and of course, what we want to do is once we go through this piloting phase and we have completed this, the Prime TB project is about supporting these 11 priority countries in developing national strategic plans for TB, using a series of new tools. The TB Digital platform is one of them. There's also the IHT for TB. This is the costing and component, as well as a number of other products that facilitate collaboration among stakeholders. So we have this cohort of 11 priority countries that we work with, but of course we would like to expand the use of the platform as well as some of the other tools and the Prime TB approach to as many countries as needed. So we are really trying to develop content and material that can support countries in using this. So that we are planning to introduce some new features to the platform. I should say, but that no major restructuring of the platform is planned at the moment, or no major development is planned at the moment. I think, as I said, we've been working on this for close to 4 years now. So the major part of the development has been done. The machinery has been put together. We might consider introduction of new indicators, but not many. And of course, creating the dashboards from existing indicators that we have already uploaded. I think it's relatively easy to do, so we are happy to do that. But at the moment, there is no more funding for major restructuring or development. So in terms of the features, we are planning to include subnational level data. We think these are extremely important for the strategic planning and prioritization process. So we are in the process of introducing particularly subnational level surveillance data, the work on the diagnostic network optimization and the patient pathway analysis. As Gita mentioned, we are developing this logged-in environment. So this is done, of course, in collaboration with our information management technology department, as well as our data colleagues. And we are, quite importantly, developing user guide. So user guide on how to use the analytical dashboards. So basically what you saw from the example that you saw from Gita, sort of supersized with a lot more information. So really our priority right now is to disseminate the TB digital platform as much as possible. So this is the first, this is the official launch. This is the first of a series of activities that we're planning for the dissemination. We are planning some minor additions based on the feedback that we have already received from the 11 priority countries we have been collaborating with. So we're considering some additions for health systems data and for specific topic dashboards and specific audiences. So you have also, the other important point to mention is that we have presented to you the use of the TB digital platform for strategic planning and prioritization. And that is the focus at the moment. But of course, the machinery, the data available there can be used for other purposes. For example, they could be used for epidemiological and program reviews, or the TB digital platform or the data on it could be used for program monitoring, or for what we call subnational collaboration in the country. So to support, for example, inter and intra-provincial meetings. I think we're all familiar in some countries of these meetings where all the provinces in the country come together and they discuss about the program, they monitor the program performance, or within the province or the districts come together and do the same. So once the subnational level data are on this digital platform, these activities can be supported as well. Another potential use, which I think is extremely important, going back to the need to engage with the non-health sector and really bring TB, make TB more of a priority, is use the TB digital platform for advocacy, for multi-sectoral collaboration. So we've had some feedback and we are considering to do that, to basically identify some indicators from the TB digital platform and develop specific dashboards that can be understood by the non-TB health sector or by the non-health sector. So really speak the language of the specific audiences with this data, or quite importantly, with parliamentarians. We've seen how useful engagement with parliamentarians can be to generate resources for TB in certain countries. And then there are some possible future directions that we are considering, but, and there's a big but, it also depends on the overall direction of the World Health Data Hub and what that team is planning to do. Of course, it depends on the country requests. So if there are, if you or other colleagues from the countries are asking for specific uses of the data, and of course, of the platform rather, and of course on funding availability. So there was, for example, quite a lot of feedback that we received from countries on countries being able to customize the the data consolidation and the dashboards. At the moment, this is not possible, but if there is a lot more interest and if there is funding that we can identify to do that, we could potentially consider that. All right, let's do the summary. Okay, so I'm going to close this webinar just by providing a very short summary of what we've seen. I hope we have made the point that strategic planning and prioritization for the TB must be country-led, data-driven, aligned with the broader health system goals, and built on an inclusive dialogue of all relevant stakeholders. The people-centered framework for TB program planning and prioritization can support the consolidation, it can support various phases in the development process. So it can support the situational analysis, the formulation of goals, objectives, and activities, and facilitate stakeholder engagement. The TB Digital Platform ensures the safeguarding and facilitates significantly the consolidation, analysis, and visualization of data for strategic planning and prioritization. And finally, as you've seen, we have made available a multitude of dashboards on the TB Digital Platform hosted within the World Health Data Hub for every WHO member state. If the data are available, they're already on the TB Digital Platform. This is huge. And so we consider this a huge resource, a one-stop shop for data that NTPs should consider critical and they should use as much as possible. Next slide, please. Okay, and I would just like to close by acknowledging a few people. First, of course, and foremost, so this would not have been possible without funding support from the Gates Foundation and also the UCDC before 20 January 2025. Acknowledge the core development team of the TB Digital Platform, Gita, Arax, who is not with us in person, but has joined virtually, Marek and myself. The World Health Data Hub team, so in particular, Philippe Boucher, Roxanne Moore, Apoorv Pal, and Jean-François Saint-Pierre, and also thanking them for the slide that we presented on the World Health Data Hub. The Prime TB team at the Global TB Program, Farai, Tawhid, Deborah, and Soleil, and also thanking them for slides 6 and 7. We would also like to acknowledge the technical review and input from the national TB programs of Brazil, Ethiopia, Indonesia, Kenya, Mongolia, Nepal, Nigeria, Pakistan, Peru, South Africa, Uganda, and Vietnam. Incidentally, these are the countries, these are the Prime TB countries that I spoke about, the priority countries that we have been working with on Prime TB. And then finally, the technical review and input from Global TB Program staff, regional and country office TB focal points, and all our technical partner agencies, and then finally our roster of epidemiology consultants. So with that, I would like to thank you all for the interest in this session. We will be publishing this on GTB's YouTube channel. And you can, of course, next slide, contact any of Gita, Marek, and myself with any questions that you might have on this work. Thank you very much and have a lovely rest of the day.